Well, an Indiana nonprofit says 14% of Hoosiers don't have health coverage. Hope Healthcare Services in Hendricks County is now extending its reach to help more people in central Indiana without health insurance. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you very much, Gary. Nonprofit Hope Healthcare provides very low-cost medical care, about $10 to $30 per visit, for people who slip through the cracks in the system. Based in Avon, it's now extending its reach to Marion County after a recent grant from the IU Health Foundation. John Mollaun is Executive Director at Hope Healthcare and joins me now to tell us more about the growth. Thank you for coming to the show.
It's great to be here.
So Hope Healthcare talks about how it focuses on people in the gap. Tell us what you mean by that. What does your patient look like?
Well, the HIP program in Indiana focuses on people at 138% of the federal poverty level and below. So we begin to fill in for those folks that maybe between 200 and 400% of the poverty level. The United Way did a study, and they called them ALICE, with an acronym ALICE, asset limited, income constrained, and employed. Little savings, maybe not a lot of progression at work, but they are working.
Right. So you received a $203,000 grant from the IU Health Foundation. Tell us what that's allowing you to do.
Well, up until this time, we've had all volunteer practitioners. All of our doctors, dentists, nurses, nurse practitioners were all volunteers. This has allowed us to add 2 staff members. So for 2 full days a week, we'll have walk-ins, same day, next day appointments. It'll really double or triple our capacity. It also adds more mental health counseling and also some telepsychiatry.
So previously you had to exclude Marion County just because you didn't have the resources, versus now Marion County residents can use Hope Healthcare.
Absolutely. It was a capacity issue.
So there's a business angle to this too. Hendricks County, 75% of the businesses there have 9 employees or less. So tell us how Hope Healthcare can also be of service to small businesses.
Well, certainly not all of those employees are without insurance, but those employers are not required to provide health insurance, and many of them simply can't, or they're seasonal workers, they're self-employed. But that small business, they could be part of the people falling through the cracks, and we're certainly available to them as well.
And what kind of services does Hope Healthcare provide? You mentioned it's not just primary care.
No, not at all. We have some volunteers that do gynecology, urology, 2 pediatricians, chiropractic medicine, physical therapy. On the dental side, we'll do cleanings, fillings, extractions, root canals, oral surgery, some denture work. So
a little bit of everything.
You bet.
It's like a one-stop shop.
We try to be. We also have things like low-cost radiology, prescription assistance, labs.
And you had some impressive numbers on what you've been able to save for people who need prescriptions.
We save about $400,000 a year for some of our patients on the prescription side alone.
And we have just a few seconds left, but you mentioned off camera, you're a well-kept secret, but Hope Healthcare doesn't intend to be. So you're really wanting to get the word out.
Absolutely. The grants allowed us to really triple our capacity. So we need patience.
All right. Well, good luck with the growth. Hopefully we can drum up some interest in you.
Thank you, Kylie.